Do know? What if I told you that a single individual, living over 1,000 years ago, wrote a medical encyclopedia so comprehensive and groundbreaking that it became the standard surgical text in Europe for more than 500 years? Imagine a world without the precise instruments we see in operating rooms today. Now, picture this same person inventing over 200 surgical tools, many of which are still recognizable and in use in modern hospitals. This isn't science fiction. It's the incredible story of a man whose genius laid the very foundation of modern surgery. A pioneer who turned a brutal, often fatal practice into a refined, life-saving science. This is the story of Zahrawi, a name that should be as famous as Hippocrates, a true titan of medicine whose contributions have saved countless lives across centuries and continue to do so every single day. His work wasn't just a chapter in medical history. It was the book that taught the world how to heal. Zahrawi, known in the West as Albucasis, created a monumental work that would echo through the halls of medicine for centuries. This wasn't just a book. It was a 30-volume encyclopedia titled Altusref Liminagessa, an Altalith, which translates to the method of medicine for one who is unable to compile a book for himself. This colossal collection covered every conceivable aspect of medicine at the time, from pharmacology and nutrition to pathology and therapeutics. However, it was the 30th and final volume, a treatise dedicated entirely to surgery, that cemented his legacy as a revolutionary figure. This volume, on surgery and instruments, was a masterpiece of medical literature, meticulously detailed and richly illustrated. It was the first text of its kind to provide clear, systematic instructions on surgical procedures, accompanied by diagrams of the instruments required for each operation. The impact of this surgical encyclopedia on European medicine cannot be overstated. When it was translated into Latin by Gerard of Cremona in the 12th century, it quickly became the definitive surgical manual across the continent. For over 500 years, from the Middle Ages well into the Renaissance, European medical schools and universities used Zahrawi's work as their primary textbook. Surgeons from Italy, France, and beyond studied his techniques, copied his instrument designs, and learned the principles of anatomical dissection and patient care from his writings. He described, in unprecedented detail, procedures for amputations, cauterization of wounds, the crushing of bladder stones, and even complex operations like thyroidectomies and tracheotomies. He was a pioneer in neurosurgery and ophthalmology, providing detailed instructions on treating skull fractures and performing cataract extractions. This single volume effectively bridged the gap between the ancient medical knowledge of the Greeks and Romans and the burgeoning medical science of the modern era, single-handedly elevating surgery from a trade practiced by barbers to a respected and methodical medical discipline. Beyond his encyclopedic knowledge, Zahrawi was a brilliant inventor and innovator, a master of medical engineering whose ingenuity is still felt in operating rooms today. He understood that successful surgery depended not only on the skill of the surgeon, but also on the precision and design of the tools they used. Driven by this belief, he designed and introduced over 200 surgical instruments, many of which were entirely novel. His encyclopedia included detailed illustrations of each tool, explaining its specific purpose and proper use. Among his inventions were the surgical hook and needle, the forceps for extracting a dead fetus, and specialized scalpels and bone saws. He developed instruments for internal examinations, such as the vaginal speculum, and tools for inspecting the urethra, which were revolutionary for their time. Many of these instruments form the very basis of the modern surgical toolkit. The forceps he designed for arterial ligation are direct ancestors of the hemostats used today to control bleeding. His surgical needles and use of catgut for internal stitches, a material that could be absorbed by the body, laid the groundwork for modern suturing techniques that prevent infection and promote healing. He invented the plaster cast for setting fractures, a method still fundamental to orthopedics. He also created specialized tools for dental surgery, including instruments for scaling tartar and extracting teeth, with minimal damage to the jaw. Zahrawi wasn't just creating tools, he was creating solutions. Each invention was born from a specific clinical need, designed to make procedures safer, less painful, and more effective. Legacy as an inventor is not merely historical. It is a living, breathing part of every successful surgery performed in the 21st century. Al-Zahrawi's genius extended far beyond writing and inventing. He fundamentally revolutionized the entire field of medical science and the practice of surgery. Before him, surgery was often a last, desperate resort, a brutal and dangerous affair with an appallingly low survival rate. 2. He transformed it into a systematic science grounded in anatomical knowledge, meticulous procedure, and compassionate patient care. He was a staunch advocate for a strong doctor-patient relationship, emphasizing the importance of observation, diagnosis, and follow-up care. He insisted that a surgeon must have a profound and detailed understanding of anatomy, stating that anyone who did not know the body's structure was likely to commit fatal errors. This emphasis on anatomical knowledge was a radical departure from the prevailing practices of his time. He also pioneered numerous surgical techniques that are now standard practice. He was the first to describe the Korcher's method for treating a dislocated shoulder, centuries before Emil Korcher, for whom it is now named. He detailed the hereditary nature of hemophilia and was the first to use ligatures to tie off arteries during amputations, a massive leap forward in controlling catastrophic bleeding. His work with cauterization was nuanced and sophisticated, using it not only to stop bleeding but also to treat tumors and skin lesions. Furthermore, Al-Zahrawi placed a heavy emphasis on ethics and cleanliness, stressed the importance of sterilizing instruments before use to prevent infection, a concept far ahead of his time. He established surgery as a distinct and noble field of medicine, demanding that its practitioners be highly educated, skilled, and morally upright. In essence, Al-Zahrawi created the blueprint for the modern surgeon, a knowledgeable anatomist, a skilled technician, an innovative thinker, and a compassionate healer, whose revolution wasn't just in how surgery was done, but in how it was thought about, taught, and perfected for generations to come.